there's been a 30-year gap in looking at children's mental health. There have been a lot of changes then. There's the perception, I think, in the public, among parents, teachers, and there's actually a perception in government too, that the challenges and stresses that children are facing are likely to lead to higher levels of mental health need now than existed then. To counter that, there have been a lot of resources put into children's mental health that may have offset these concerns. We don't know.
In the original study in 1983, schools were not part of the Ontario Child Health Study, and today we realize the critical importance that schools and educators are playing in supporting and promoting student mental health. And so the systematic inclusion of schools in the Ontario Child Health Study will enable us to understand and document what schools are doing to help support students in their mental health.
By bringing these two things together, we can look at the different effects that communities or neighborhoods versus schools might have on children's mental health, and different opportunities in these two different environments to improve children's mental health and maybe offset the economic difficulties and social disadvantages that some families experience.
Teachers are really overwhelmed. The demands on teachers' time today are probably higher than ever before. They're expected not only to address academic needs in the classroom, but also behavioral and emotional needs of the students. At the same time, teachers' perspective is critically important. The School Mental Health Studies was designed to include teachers in the survey so we can understand what they're dealing with on a day-to-day basis, to hear their voice, to hear their experiences, and to represent them as a whole to see what's working and what might not be working.
Our team will be providing all of the materials needed to complete these surveys. This involves promotional materials like posters and information brochures for teachers. It also involves all the consent forms that need to go home with kids, and of course the survey materials themselves.
After they're filled out, they'll be shoved into a nice envelope and sealed and brought down to the front office, and then we pre-arrange FedEx to come and pick up the surveys from each of the selected schools and bring them back to our office. We will then enter them into our research data system. No one will be able to link what each student, teacher, or principal said to the actual data that's recorded into our system.
We say these surveys are designed to be hassle-free, and by that we mean that everything will be clearly labeled in packages, everything should be handed out relatively quickly, and instructions are provided and scripts are provided, so really there shouldn't be a lot of ad-libbing on the teacher's part. It will be all laid out clearly for them as to what needs to be done, how, and when.
The first step is understanding what's happening in a classroom, not only from the student's perspective, but also from a teacher's perspective. What are the demands that they're feeling? What supports do they need in the classroom to help students? And so their perspective on their needs, but also on the strengths and what they're doing that's working, is incredibly important.
These larger scale studies highlight important problems, challenges, and issues in society, and bring attention to the need to address them. That's what happened in 1983. I think it'll happen again in 2014, that it will cause an alert to go out that's based on information systematically collected, not just based on headlines in the newspapers or what people think. And that's a critical element, I think, in rational planning and allocating resources, that we have evidence that's collected in the population and can be used for that way. But the big impact of these larger scale studies is the big picture impact and effect on policies around resource allocations to kids and kids' mental health.
We're asking teachers to report on the school climate. So school climate, we're very interested in the relationships that exist within a school, the level of discipline within the school, respect for diversity. We're interested in understanding the day-to-day strategies that teachers are using to promote student mental health. We're interested in understanding their perception of students' mental health and behaviors in the classroom. There's no room on the survey to put their name or any identifying information. All information will be placed in a sealed envelope and sent back to McMaster University, where we'll be analyzing the data in a secure environment. There's in no way any interest in identifying any specific teacher, but rather to understand teachers as a group. What are they dealing with currently within their school settings? As an educator, we realize you're playing a critical role in trying to address the mental health needs of students in your classroom, and those needs can be very diverse, and I can only imagine how demanding it must be on your time to try not only to address the learning needs of students in your classroom, but also the social and emotional needs. And what teachers are doing is incredible, and what we want to try and do in the school mental health surveys is to try and systematically collect what teachers are doing as a group to try and address student mental health needs. and in doing so identify those strategies that might be reducing levels of mental health need in their classroom, promoting student mental health, and using those strategies that are the most effective to try and encourage more and more teachers to be using them on a larger scale. And so what you're doing and what you're experiencing is critically important to capture in our surveys, and we would really want to represent every teacher that's been approached, to have a representative sample of teachers and to try and understand what your needs are to better support you.
Think about your classroom. Think about what it's like to be at the front of the class teaching your children in the classroom. Think about what your objectives are around increasing their capabilities. Think about some of the challenges you're having or likely to have with 2 kids maybe in the class, but it could be as many as 5 or 6, and what are those nature of those challenges? And I'll bet you money that they have to do with emotional regulation or behavioral regulation in the class, things that we would associate with children's mental health. And think about the impact that has on your ability to teach in the classroom, to do what you really want to accomplish. We think that the biggest component, biggest struggle that teachers are having right now, focus on children's mental health in the classroom. I think that's being recognized and acknowledged in the Ministry of Education and the government with new initiatives, and that we need to sort out better strategies for helping teachers, people like you teaching, to cope with these challenges in the classroom so that you can get your job done. And we think this study will help to do that. So you can only help us to do that if you participate. So say yes.